Welcome to your City Hall. It is great for you to be here. It's great to have you here at City Hall. You know, they used to say that a conservative was a liberal who got mugged. Well, we know a liberal is a conservative that got sick. Because in this state right now, 6.5 million people don't have the health care that they work hard for and that they deserve. And Los Angeles has stood with Sheila Kuehl, with all of you, and year after year we have endorsed, as a city council, signed by the mayor, a single-payer system for everybody. Los Angeles says the time is now.
Do you want good health care? Do you want it to be affordable? Do you want it to be universal? Do you want to go to any practitioner you like? What's the bill that does it? There's only one thing, one kind of entity that adds no value at all to health care, and that's the insurance companies. They take, and their whole job, I mean, you saw it in Sicko, didn't you? It was really wonderful to hear people talking about it. Their whole job was to keep people from getting health care. They get bonuses for the people they turn down. Blue Cross? Double cross. Blue Shield? No shield. And I'll tell you, this bill, honestly, is the gold standard for health care. It would set the standard for the rest of the country. It would set the standard for the expansion of Medicare for everybody in the country. It's the only thing that makes sense. Once a year, you'd pay a premium, or if you like, every month, 1/12 of your premium. That's it. No copays, no deductibles. And what do you get for that? You get 24/7, very high quality, comprehensive care. And there's been one person who's been with us from the very beginning, who helped us raise money to make a film about this bill, and who is the funniest, most brilliant, most committed, brightest, I don't know, all-around best human being in the universe, and that is Miss Lily Tomlin.
Okay, now, I've prepared an Ernestine routine for you. Care Control Insurance Corp, Claims Department, Ernestine Tomlin speaking. State your record number and be quick about it. Your name is not important. Here we do everything by the numbers. Ka-ching, ka-ching. Care Control, what's your gripe du jour? No, not covered. Being blind is a pre-existing condition. You should have read the fine print. It's your nickel, speak up. You were shot in a subway? Next time eat at Quiznos. Ernestine claims no can do. No, sir. No, we consider that an elective procedure, meaning we elect not to pay for it. It's not our fault you've had 2 heart attacks. You should have stopped at 1. Next life, learn from Dick Cheney, don't have a heart. Ernestine claims, choice of doctor, of course you have choice of doctor. Do you want the doctor we give you or not? It's your choice. Your family doctor is not in our coverage area. No, our nearest preferred provider is, let's see, if you hop on a plane right now, you might get there before the blood clot travels to your brain. You must think HMO stands for help me out. We don't care if you're fed up, just if you're paid up. Don't you get it? It takes big bucks to run an insurance company. Medical care is the least of it. You wouldn't believe the paperwork. All this waste doesn't come cheap. Remember, here at Care Control, your health is our business, not our concern. Thank you all. Thank you.
We've got a hard task ahead of us, but there's nothing more important in this nation than to change the present health care system. We cannot continue. It's time for this nation to change what's going on in our health care system. It's certainly clear. You get sick in America, you lose your job, you stand to lose everything you've worked for, including your life. This is not America that we want to live in. We must change the healthcare system in America, and it will only be done when all of California understands the problem and is willing to do what you've done today. For 40 years, we've had a single-payer, universal healthcare system that is available to everyone who meets one single criteria: live long enough to become 65. It's Medicare. America did it 40 years ago. We have a chance in California to do it here. What will it take to create a universal single-payer system in California? It takes you. And it takes the leadership of a state senator like Sheila Kuehl that has devoted all of her career to creating a single-payer, universally available healthcare system in California and then in America. Thank you very much.
In traveling this country, I've had the opportunity to hold hearings on health care, and I can tell you that this is the single most important domestic, economic, social, and moral concern of this country, and the people of California here today are to be appreciated and applauded for uniting this state on the cause of health care for all. But we can't stop there. We need to create a movement, and it's part of a pro-democracy movement here in the United States, to say that health care is a defining right in a democratic society. Let's talk about a vision of the America that can be. An America where everyone is covered. An America where everyone has a card that the minute that they have a problem, they can give it at a hospital and they're covered. They can go to the doctor, they're covered. They don't have to pay anymore, they're covered. There are no co-pays, they're covered. There's no deductibles, they're covered. That's the America I envision. That's the America that I'm ready to call forward. That's the America I intend to fight for. That's the America that's waiting for a president who will challenge these financial interests, who have a lock on our system, and we're going to break that lock. We're going to lift up our people. We're going to create a country that's health care for all, a defining right in a democratic society. Let's make this happen. I'm your candidate, and I'm prepared to deliver. Thank you very much. Thank you.
And I look at this tremendous turnout today. This is a historic day, and I know that we are on the side of history. Gandhi once said, first they ignore you, then they laugh at you, then they fight you, and then you win. Well, they're done laughing at us, let me tell you. And we're going to win this fight.
Brothers and sisters, all of us in labor know that we are sick and tired of hearing about working men and women in California that don't have health care.
All change comes from the bottom, and we are the only ones that can make it happen.
Health care is a basic human right, and we are going to have to fight for it. The old saying goes, you've got nothing without your health. I agree, and I can't think of a more worthy cause to fight for.
CSCA is proud to be a sponsor of Senator Kuehl's legislation, and we stand committed to fight until universal health care becomes a reality for everyone.
SB 840 allows us free choice of a doctor.
In California, with one of the wealthiest economies in the world, we now have more than 800,000 children who are uninsured. That's an outrage. There must be a better way.
It is time for the religious community to go on record supporting universal single-payer health care. California Council of Churches supports this bill, and we are thrilled to be here with you today. Thank you. Thank you very much.
Our healthcare system works in support of corporate greed instead of human need. And this must stop.
Currently, health care benefits in LAUSD cost $800 million. In a couple of years, it's going to be $1 billion. We could save huge amounts of money if we enacted comprehensive health care reform.
And if in the 1950s and 60s, we could fight against the Jim Crow South to bring the best legislation that exists in this country to give human and civil rights to people who are underprivileged and oppressed, then certainly we can have a movement today to bring health care to those who are in most need today.
If our foremothers could get us the vote, we can get single payer passed. We will overcome the insurance and pharmaceutical interests the same way, with passion, commitment, and hard work. The tide has turned. We will persevere. We will win. We will have single-payer health care in California. SB 840 now. Thank you.
This is not the end of a grassroots campaign. This is the end of a 365-day cycle, which means, knowing the way things go, it's the beginning of a 365-day cycle. So for the next 365 days, do something. I don't care what it is. Do it with your group. Do it by yourself. Wake up in the morning, make 3 phone calls. Call the governor every day. Drive him nuts. That's what I do. So thank you, thank you, thank you. Keep up the good work. Thank you.
We come from the land of milk and honey. We stand, but the healthcare industry's addicted to money. All for one and not one for all. 47 million in dire straits, excluded by greed and wealth. So we've got to get united in these states and put the care back in health. Come on, y'all. Oh, sing healthcare justice for all. Justice. Oh, healthcare justice.